So what's the association between endometriosis and early natural menopause? I'm Dr. Wendy. I'm a physical therapist. I've taken care of women for almost 20 years, and I love to find research articles that help me explain what we see anecdotally. So in this particular article, that associated between laparoscopically confirmed endometriosis and risk of early menopause, I thought, ooh, let's see that. So just so you know, the official way to diagnose if you have endometriosis is through surgery. So these people were confirmed endo, and what is the risk of early natural menopause? And this particular article is from 2022 JAMA. So they asked the question, is there an association between endometriosis and early natural menopause? And in this particular study, it was a large study, a cohort study of 106,633 premenopausal women. A statistically significant association was found between endometriosis and early natural menopause. So early natural menopause means before the age of 45. The risk was greater for women that had not had children and women who never reported using oral contraceptives. So let's take a look at this closer. So endometriosis is often a chronic inflammatory disease characterized by the presence of endometrial-like tissue outside the uterus. Although endometriosis affects approximately 10% of women during their reproductive years, it is associated with many other health outcomes, including early natural menopause. Well, this particular study looks at it because they weren't sure, does it? They go on to say that early menopause is defined as the cessation of ovarian function before the age of 45. This affects approximately 10% of women in Western populations. Endometriosis is associated with a greater risk for cardiovascular disease, cognitive decline, osteoporosis, and premature mortality. Well, just that sounds fun. Multiple mechanisms support the hypothesis that endometriosis, or specifically endometriomas, the cysts, right? The endometriosis subtype categorized by ovarian cysts, and the treatments associated with it may have qualitative and quantitative implications for ovarian reserve. We know that endometriosis has been associated with a lower ovarian reserve among women with female factor infertility. Endometriomas have been associated with ovarian aging and menopause timing. Okay. Perimenopause and menopause are ovarian insufficiency. Okay, it is an insufficiency. So if this is saying endometriosis is all this, it does make sense. It makes the case that early natural menopause can happen to women who have endometriosis. But that's why we're reading this article. We're going to keep going. I just want you to know why. They go on to say that in addition, local and systemic increased inflammation has been associated with endometriosis and hypothesized to be associated with early menopause. However, these associations were nonlinear and inconsistent among markers. Women with endometriosis compared with women without endometriosis have peritoneal fluid, so within your abdomen, that contains more activated pro-inflammatory, meaning more likely to be inflamed, chemotactic and oxidative stress factors, meaning you're a hot mess of inflammation chemically, which could create an environment that is detrimental to follicular and ovarian function and leads to an early age at menopause. So if you have endometriosis, they're saying you are chemically, literally more inflamed. And if you have endometriosis, you're nodding your head because you're like, yeah, I totally get that. So in their study discussion, and it was a large study, they observed the surgically confirmed endometriosis was associated with a significantly greater risk of early natural menopause. The risk estimate remains robust and statistically significant with adjustment for demographic and behavioral factors. The association was slightly attenuated with additional adjustment for reproductive factors, but remains statistically significant. So, if you have endometriosis, it is saying there is a chance you may go through menopause earlier. So before the age of 45. So if you have seen any of my posts and you are commenting that you are a woman who has gone through menopause early, something to think about. Just so you know, This is the only study to have looked at this. They are the only ones. And this is a large study and it is a well-designed study. So we could truly apply this to the masses. This is not a novel concept. This is not a pilot study. This is kind of a big deal. Remember one more other factor. Those with endometriosis had the highest risk for early natural menopause if they didn't have children and they didn't use oral contraceptives. Hit the plus sign and follow for more women's health and wellness tips. Bye.